Hi, it's nice to meet you. My name is Michelle. I am the sleep tech who's going to be conducting your sleep study today. Before we begin, do you have any questions? Not yet. Okay, well, if you come up with any as we go, feel free to ask, okay? I want you to be completely aware of everything we're doing. So let me just grab. Just gonna plug this. Untangle the wire just a bit here. Okay, so I have this little clampy guy, and he's just going to go right on your finger like so. See? Easy peasy. And this is going to be reading the oxygen saturation in your blood, so how much oxygen you're getting, as well as your heart rate. So I'm just gonna stick this onto your finger, okay? It's not uncomfortable. Okay. And then let's just get this wire so it's not gonna trip anyone. And then I'm just gonna turn on my little machine here. Takes just a second to load up. Come on. Okay. I'll put that on silent so you don't have to listen to it beeping, since the point here is to sleep. And so now that is reading your oxygen saturation, which is good, it's high, and your heart rate. So, okay. One of the things that we are looking to rule out is something called sleep apnea, where you stop breathing while you're sleeping, or you get kind of choked up. And so if this number drops all of a sudden, we'll know that that's something we need to be looking for. There's also a little alarm that connects into my office that will beep and go off if something abnormal is going on. Okay? So before we get started, I'm just going to do a quick little exam. So try to keep your eyes open for me, okay? Okay, the other side. And I just want you to look up. Yep, keep your eyes open. Good. Okay. Okay. Looks good. Okay. Now I'm just going to take a look into your eyes, into the lens, okay? now. Just keep your eyes open. Good. Good. Okay. Great. Okay. Back. Okay. So now I'm just going to do something of a hearing test, and it's also a cognitive functioning test as well. I'm going to say a word in each ear, and I want you to repeat to me what word you heard, okay? Okay. So, let's start over here. Porcupine. Good. Okay. Cucumber. Good. Okay. Spaghetti. Good. Coconut. Good. Okay. Just a couple more, okay? Chocolate chip. Yep. And the last one. Dental floss. Good. Good job. Okay. Oops. Okay. I'm just gonna make a note in your chart, okay? This won't take very long. So now I'm just going to do a test for your depth perception, okay? So it's going to look like I'm going to poke you in the eye. I promise I'm not actually going to poke you in the eye, okay? But I'm just seeing at what point when my finger comes towards you that you blink, okay? So I'm going to start. Try to keep your eyes open. Good. Good. Excellent. Good. Okay. Great. Okay. That portion is all done. And one last little thing before we get you hooked up. Just getting it out a little tool. Okay. So I know this looks a little bit terrifying, but I promise it is not. See, it's on my hand and it doesn't hurt. I can do it on my bare skin and it doesn't hurt either. It's a little pokey, but this is just making sure that you have complete nerve function in your extremities, okay? So I'm just going to take your hand. Yep. Just lightly run it on your palm. Good. Okay. The other hand. Now I just want you to close your eyes and tell me which hand you feel it on. Okay. Yep, keep them closed, no peeking. Good. Yeah. Good. 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 Excellent. Okay. I'm just gonna put this back. Okay. So, before we get started, is there anything you need? Do you want to go run to the bathroom? Okay. Well then, we are going to get started. So, to begin, for just a moment, I'm just going to turn your head slightly towards me. Is that okay? Any pain in the neck? No. Okay. that okay? No strain? Good. So, what I'm going to do is I'm going to stick some electrodes onto your head so I can monitor your brain waves and your brain activity while you're sleeping. But I want to make sure that these stick really well. So I'm just going to clean off some spots on your head if that's okay. Okay, so okay. I'll just toss that. So good. Okay. Just gonna dry off your forehead. Excellent. Okay. So now what I'm going to do is I'm going to take a little pencil and I'm just going to make some dots just to give myself a map for where to place the electrodes. So don't worry, this is just like an eyeliner pencil. It's not going to stick or stay. I'm just finding the center of my ruler so I can place it right here. And I'm just going to line up my pencil. Now we're going to do it. I'm just going to stand up this way. Okay. So, just looking. Okay. gonna stand up and grab something really quickly. Alright. So now I'm just gonna use this comb and this clip. I'm just going to put here right now so I can make a part in your hair, okay? I'm going to stand up to do, actually I could do this sitting down. Okay. Okay. Okay, good. I want to be gentle. Okay. I'm just gonna take this hair and clip it out of the way. Okay. I just want to make sure we are lined up. Okay. They have a little bit of static cling on them. Good. And I'll take this out. It's gonna move some hair on this side. little lost there. Okay. So now I am going to stand up, okay? I'm just going to clip these right on the leads. At any point these get stuck or uncomfortable, just let me know. And I can adjust them easily enough. Some extras in here. And the last one. Okay, and I'm just going to take these back here so they're not in your face. I just want to make sure these are all sticking like they're supposed to. Okay. Good. Okay. All right. So I know there's a lot going on here, but in a moment when I step out, you'll be able to get a bit more comfortable and get yourself in a better sleeping position, okay? So I am going to give you a pair of noise isolating headphones, okay? These are going to, first of all, block out some of the hospital noise, because I know it gets to be a bit loud in here. And also it gives me a way to be able to communicate with you. There is a little microphone hookup, so that way I can talk to you through the earphones, okay? Stand up and place these. have muffled the sound a bit. Okay, so you should be able to hear me a bit better. Yeah? Okay, good. So, I'm going to step out, but I am going to be in an office partition right over there. There's a window so I can see you. Okay? I'm going to be monitoring your vitals and your stats all night long. So if anything weird happens, I'm going to know, and our computers will also know. They will make a note and alert. So that way we are absolutely sure we don't miss anything. Okay? Okay. So if you need anything, there's a button right here that you can push, and it's going to alert me. And then I can come right in and see what's going on. Okay. Try to get comfortable. I know it's a little bit weird, but most patients, it takes them a few minutes to fall asleep, but then they manage to do so. But if you are struggling, we can give you a little bit of melatonin, but let's try without for now, okay? Okay. So you're comfortable? You're warm enough? Good. Okay. I will be right in there if you need anything.